massive leader in making sure that we advance health and racial equity through healthy housing. It's my pleasure to introduce Matt Ammon.
Thank you, Ruth Ann. I think my best attribute over the last 28 or so years working at HUD is that I listen. I listen very well. And I think with that, you know, we've had such a great partnership with the U.S. Department of Housing and Development and all the agencies, local, that have made such a great difference in Baltimore. And so, you know, it's my honor to be here today. I thank you all for being here. I thank Mr. Mayor for being here. All the partners, the city and state departments who are here, the medical community partners, the community and parent organizations, the Green and Healthy Homes Initiative, my staff, our HUD staff. I mean, it's great that we are all here today, and I really feel like I'm among colleagues and friends, unless, of course, you rooted for Cleveland yesterday. So it's been my honor to work wrong. That's right. It's been not only my honor, but the department's honor to be partners along with you in addressing the issues facing families in Baltimore by making their homes healthier and safer, particularly around eliminating lead-based paint. But it's been my duty to make sure that we listen to what your needs are so that we can have better programs and policies that serve your needs locally, since we know that everything happens locally. But what has brought us here today is a celebration that began 30 years ago when the nation stood up and put forth a bold set of actions to address a critical health issue, when 1 in every 6 children under the age of 7 suffered from elevated lead levels in their blood. And Congress, of course, with the Maryland delegation, notably Barb Mikulski, passed Title X, but also created our office, setting a partnership with the city that has spanned more than 28 years. Baltimore received one of our first grants back in 1993. And we've always seen Baltimore as a model of this work in building coalitions, being innovators, addressing homes in a holistic fashion by addressing lead and other housing-related health hazards, establishing models of practice, and working with all of their partners to make sure rental homes and owner-occupied homes are safe. And we've had so many other successes. I've been here many times celebrating that work that you all have done and the progress you all have made. This work has resulted in having some of the largest decreases in the number of children with elevated blood lead levels across the country. These are tremendous accomplishments towards working to solving the problem, to break the link between unhealthy housing and health. And each one of us here, as individuals and organizations, we represent a piece of the solution to mitigate the impact of unhealthy housing, the solution to preserve affordable housing, and the solution to improving communities and the families that live here. And transforming communities can start with one home, like the Ballantyne's family home behind me. That one home is evident of the work that we can do, and that this work matters. Making homes health and safety will ensure that future generations can reach their full potential. But none of us here today think that the job is done. But all of us here today are committed to see the job through, to continue making progress, to better the lives of families and children of Baltimore, to see them grow and be the next leaders that will continue to make this city thrive and prosper for everyone. Thank you.
I want to take a moment to recognize some of our elected officials and agency representatives that are here before I bring on our city's leader. But I want to thank Cliff Mitchell, who's representing the Maryland Department of Health, Joe Seahazen and Jack Daniel representing the Maryland Department of Housing and Community Development, Kaylee Laker from the Maryland Department of the Environment, Councilman Glover, who represents this district in the Baltimore City Council, and also Michael Moore, who is representing Baltimore Public Housing. We thank you very much for being here today. It's my honor to introduce to you a young man who leads our city today with great vision and understanding of the problems of housing and health and our opportunities for investment to change the future for Baltimore's children. It's my pleasure to introduce Mayor Brandon Scott.
Good morning, and thank you, Ruvan, and thank you, more importantly, not for the introduction, but for the great work that Green and Healthy Homes Initiative has been doing in Baltimore for many, many years. Good morning, everybody. For 30 years, HUD's Office of Lead Hazard Control and Healthy Homes has been working to reduce lead-based paint hazards, and we are grateful that HUD recognized the tremendous need here in Baltimore City, and that we were one of the first recipients to receive funding when the office was created. We are even more grateful that HUD has sustained that funding commitment over the years, that they recognize the important work of the office and what it has been doing for the residents of our great city. And we are working, as you all know, to right years of lead contamination injustice, like what has been reversed here at the Valentine's family home. And Mr. and Mrs. Valentine said to everyone who worked on the project, the work was perfect, the workers were great, and they got the job done in the most efficient and effective way that they could. But this is what this work is about. We know that exposure to lead is the most significant and widespread environmental hazard for children in Maryland, especially here in Baltimore. And exposure to lead can cause long-term neurological damage that may be associated with learning and behavioral problems and with cognitive ability loss among our young people. It is painstakingly clear that these issues most impact young people living in traditionally underinvested in neighborhoods. Lead-based paint hazards in homes are the most significant lead hazards. We all know that our city has one of the oldest and largest inventories of old housing in any major city in America. Of the more than 260,000 occupied properties in Maryland built to prior to 1950, 40% of them are here in Baltimore. The health risks from lead exposure compound existing disparities in the quality and access to care available to our low-income residents. We want to look at everything we do through a lens of equity. Addressing the disproportionate harm of existing lead service pipes will help to bridge the health gap between communities that are invested in traditionally and those that have been neglected in, that we are now going to invest in. These are families who lack the resources to identify lead risk in their houses, make necessary renovations, or rent their house from landlords who are unwilling to make repairs. The good news, however, is that lead poisoning is an entirely preventable environmental justice, and early intervention is key. The city has had a tremendous partnership with Green and Healthy Homes Initiative, with our friends at Johns Hopkins, with Parents Against Lead, the Annie Casey Foundation, and many, many others here today. Because of those combined efforts over the years, in 2020, childhood lead poisoning cases in Maryland decreased to the lowest level since data had been collected in connection with the state's 1994 lead law. And in Baltimore City, 0.7% of young children tested show blood levels at above 10 micrograms per deciliter, also the lowest comparable percentage since the data started to be collected. That is something that we all should be proud of. Working together, we realized a 99% decrease in children who tested positive for elevated blood levels in Baltimore City. And the work to abate lead hazards is an important investment that we are making for our children and their future. We are identifying sources of exposure and working at multiple levels to protect our residents. However, we won't and we cannot rest until lead contamination is no longer an issue that our residents, particularly our young people, have to face. I just announced the pillars my administration will be focused on moving forward. This is our action plan going forward, building on the foundations that we have laid to transform Baltimore into the best version of itself. Clean and healthy communities is a key pillar and is central to the quality of life of Baltimore. We are all about improving the well-being of our residents, and it is fitting that we acknowledge the good work that has been going on and that we continue to take this time to invest in those things by recommitting ourselves to that work and innovation. We will continue to foster those partnerships and build upon the work that HUD and so many others, and thank you so much, Matt, for being here today, that so many others has been doing regardless of zip code, that do not have to deal with the failures of the past so that we can correct them so that children can grow up lead-free. If we all know, if you grew up here in Baltimore like I did, and you've seen friends suffer from lead poisoning, if you've seen when they tell you that you can't drink out of the water fountain in the school because it has lead pipes, you know how deep this issue is. It is connected to everything that everyone says is wrong with the city. Because when you have years of that exposure and your mind and your body is not functioning in the proper way, you are then more susceptible to addiction, to violence, to many things that plague our city. So this is why this is just as important as things that we do that folks think are big and sexy. This work is critical to making sure that Baltimore is the best version of itself in the future, and we will continue to partner with anyone that helps us reduce lead in our houses. Thank you.
Before I bring up our council president, who I've known as a stalwart in fighting for the eradication of lead poisoning and healthy housing in the legislature and now in the city council, I want to thank a few more people who have joined us. Shannon Sneed, representing Senator Van Hollen, I think I saw, and Senator Van Hollen has set an earmark in the U.S. Senate for the budget when it gets passed, hopefully, to join in the investment to improve health and racial equity through healthy housing. I want to thank our former health commissioner and dear friend from the Johns Hopkins School of Public Health, Josh Sharfstein, for being here, who has been an incredible advisor and advocate for decades. And from the Baltimore City Health Department, there is none better than Camille Burke, who's representing the Commissioner Letitia DeRaza, is my colleague on the Lead Poisoning Prevention Commission. I also want to thank Jerome Stevens from the Senator Cardin's office. And I think I saw the young man, Bob Embry, who has been at the heart of helping to improve Baltimore at the Able Foundation, who gave us some of our earliest funding to do this work. So with no further ado, let me bring up Council President Nick Mosby.
Let's give it up for Ruth Ann for the decades worth of hard work she's put into this. We know that for decades, redlining, failed policy, and the lack of action have brought us here today. It's been communities all across Baltimore City, black communities, brown communities, that have been disproportionately impacted by something that should have never happened, by something that should have been eradicated before. We constantly talk about fighting for our young folks. We constantly talk about the crime that plagues our communities. We constantly talk about the issues that we have with education here in cities like Baltimore and cities all across this country. But what we never really talk about is the root causes of that. I've had the ability of fighting for several years with Ruth Ann down in Annapolis to ensure, Ruth Ann, that we're not just talking about what elevated means. Because Ruth Ann will come up here and she'll tell you the science that it's proven that 1 microgram per deciliter is enough to affect the child for the rest of their lives. And Bob, the reality is we've made progress, but in 2019, 560 children here in the city of Baltimore were tested with elevated levels of lead in their blood. That is unacceptable. And we stand here today as a step in the right direction. But we understand and know that we can't stop and we can't cheer and we can't pat ourselves on our backs until we know that every single child in East, in West, in Southwest, in Northeast of Baltimore is safe from being able to go and live in a healthy, clean environment. The fact that we still look at it, and look, we've come down from 10 micrograms per deciliter all the way down to 3.5. Is that right, Ruth Ann? We're at the threshold right now. It's 3.5. Unacceptable. It's been studies proven over and over, right here in the city of Baltimore, Johns Hopkins University, that 1 microgram per deciliter affects a child for the rest of their lives. The direct correlation to education, the direct correlation to the criminal justice system. We understand and know that to be a fact. So that's why we stand here today. I stand here committed with HUD, with our state partners, with our city partners, with our mayor, with the nonprofits, to ensure that we're taking a step in the right direction. Right now, we have a very unique opportunity to clean up our communities through the American Rescue Plan Act money. This is a moment that we might not ever get to provide the next generation of young folks in the city of Baltimore a chance to live out full and productive lives. The things that we tell them in school, that you can grow up, you can be whatever you want to be. You can do the right things and you can be pushed and you can go and take advantage of real opportunities. That you can stand up here and you can be Mayor Brandon Scott. Well, for some of our children, that's taking away at the very beginning of their lives. That's why we are all here today. So let's not talk about crime. Let's not talk about education. Let's not talk about the systemic issues that have plagued our communities for far too long until we're serious about talking about how we eradicate these situations that we put our young people in every single day. That is what Ruth Ann and our organization fight for. That's why I've always been a staunch supporter, and I thank you for your committed effort, Ruth, in doing this. I thank you for the partnership of the federal government, as well as our state partners, and as well as our amazing Mayor, Brandon Scott. Thank you. Next up, we're going to hear from the councilman in this district, Councilman Tony Glover.
Good morning. Lead abatement, excuse me, lead abatement and creating healthy homes initial to changing the trajectory right here in our neighborhoods is very important to the city of Baltimore. People want to live here. People want to live in healthy environments, healthy neighborhoods, where they can raise their children free of lead, stress, of medical conditions that overcome some of the hazard conditions that we face each and every day. Organizations like Ruth, Southeast CDC, St. Ambrose Habitat for Humanity, and NEHA are working very, very hard to ensure that our residents not only have access to better homes in this community, but also affordable and healthy and safe neighborhoods. This hit me hard here in East Baltimore. This is my neighborhood, born and raised here my entire life. I played all up and down these streets with classmates as we left from this community to go to Hampstead Hill Elementary Middle School. But to see the change that is really happening here in our community with the help of these organizations, the mayor, city council president, and many of my colleagues across city government, I'm excited to see the changes that we're making here in East Baltimore. Thank you.
Well, the work we do is about families, and the work we do is about the commitment to improve the lives so that kids get to the classroom healthy and ready to learn and to compete for a lifetime. The investment here is about ensuring that families live with dignity and health and opportunity. I think we all know that coming out of this pandemic, a safe, healthy home is even more critical and more in the minds of our residents, our communities, our neighbors. So I want to thank Aurelia Ballantyne for being here today and joining me at the podium to say a few words about the work that she allowed us to partner with her to do. Her grandson was poisoned by lead, which led us to this home where we were able, granddaughter, sorry, we were able to not only help with lead, but other measures in the home to create a healthier environment. We thank you for allowing us to use your home as an example today and joining us, and I wanted to give you an opportunity to say a few words. Thank you.
Good morning. I am so happy and blessed that these people came to my home, picked me out of everybody else, and did all this wonderful work that they didn't have to do, and made my house a safe home for my daughter and my grandbaby, Kaylee, who had the blood poison from the lead. They did a lot of work in my house, you know, to make it newer and be fresh and look good. And if anyone want to come and look, they can. They still doing work in my home to keep it safe, put things on my steps so I won't slip, on my rug or my porch so I won't slip. It's a blessing when people take time out and for older folks and show the love, because we need more of that in our neighborhoods, to show love and caring for people. I'm about to cry, I'm just happy. I thank God for each one of y'all and everything that you put into it, you know, sharing to you know, make it, this thing come together. And I just thank God for everything that all of y'all have done, just a beautiful job, and this department will continue to grow for other people as well as me, and that everybody will just be blessed and happy, good blessing and good health. And just thank everybody. I thank the mayor for coming here. It's a blessing. And I thank all the other folks, because I don't know y'all names, since I don't want to leave no more. I say everybody that's out here. I just want to thank each one of y'all for the input that you put into this neighborhood in my home. And I just love all of y'all. And thank God for y'all. And that this will continue to be going on for, you know, forever. Because we don't know what one day will do. Just take each day for the blessing, because tomorrow's not promised to us. So we're just showing love, and this is love. And I thank you.
I kind of think we should end it right there. I don't know that there are finer words spoken, and thank you. In our organization, one of our core values and tenets of operation is to lead with kindness and love, and I appreciate you. This doesn't happen overnight. Where we're going is still ahead of us, and it takes the toil of many. So I want to take this moment right now to thank the current and former staff of the Green and Healthy Homes Initiative for all that they have done in fighting battles from the time we were the Parents Against Lead, to the Coalition to End Childhood Lead Poisoning, to the Green and Healthy Homes Initiative. Home visiting's not easy. Fixing windows, replacing windows, scraping paint is not easy. Figuring out all of the policies and practices that need to get changed and reverse unjust and ill-conceived policies and practices that left people behind is not easy work. So I want to take a moment just to honor my staff. Thank you. If you would raise your hands, I appreciate you being recognized. And a special shout out for today to Wes Stewart and the family advocacy team at here in Baltimore, but also Nicole Hart and Shanika Kyer-Frazier and Yolanda Brown from the city and from HUD, who brought us together today. Not only here, but when we leave, there will be a listening session, because we have more to learn about our path to health and racial equity. We have been spending a lot of time in this work trying to get investment from healthcare, because what we do is healthcare. And I'm very honored today to be joined by Taylor Gray Peel from the ProMedica Impact Fund and the ProMedica Social Determinants of Health Institute. ProMedica is a Medicaid managed care and health system out of Toledo, Ohio. But Taylor is here today because they have stepped forward to join with the Green and Healthy Homes Initiative to do 7,000 homes across this country to make them healthy, lead safe, climate friendly, and energy efficient, and to measure the impacts of health and racial equity so that we can make substantial changes in our healthcare system. And Taylor and I are here to announce that we will be doing 1,000 homes together here in East Baltimore. Councilman, in your district, to not only prove that this works and that we need to do this at scale, but to honor the families who have been left behind and to start to give our contribution to writing the future on racial equity. So Taylor, thank you for being here. And thank you to all of our healthcare partners, Hopkins, Amerigroup, and others who are helping us do this work. But it is a long path. There are many people to thank, but I cannot be more pleased than to recognize Kim Turner and her sidekick, Mary Jo Slowey, who has been my friend for, I think, 30 or 40 years, 30 years. But Kim served as the original coordinator for the vision of the parents who had their kids poisoned by lead, who spent 28 days with deep muscle injections being chelated at Hopkins and other health institutions. And they knew that what we needed to do was to address the twin tragedies of deteriorated housing stock and poisoned children, and to turn their light outward to say that we can and must do better. So Kim, I am honored that you are here and honored on behalf of the families and the vision, and thank you for that. I don't know if Delegate Rosenberg has arrived. He is on his way, I think. But Sandy Rosenberg was one of the first people to stand up in the Maryland legislature and know that we needed to change the course of history, and that we needed to get away from the intractable issues of having thousands of lawsuits a year after the fact when kids were poisoned, and instead move to primary prevention of lead and to end its toxic legacy. So when Sandy arrives, please join me in thanking him, but I wanted to honor him in his work and the many good legislators, including Robin Lewis, Brooke Lehrman, and others, Corey McCrae, and others in the Maryland Assembly today fighting this good fight. And we are going to continue this work. We're going to be at everyone's door looking for the resources to do this work. I asked a health institution this morning for $100 million to join us, and we hope that they will do that, that there is an opportunity to have Baltimore lead this nation to a better place. And I will just close to say, before I have the pleasure of bringing up my favorite housing commissioner in the world, that in his last days, Elijah Cummings asked one thing of me and one thing of all of us. And that was to change what is normal for people living in under-resourced communities and communities that have been left behind. It should not be normal that your child will have an elevated blood lead level, or that your grandchild will face that hazard. It is not normal that where a child lays their head down at night is the cause of them going to the emergency room or the hospital instead of the classroom. It is not normal for us to have housing condition where older adults cannot age at home with dignity and health and lose value in their housing and in their property, and therefore not have the generational wealth transfer that should be incumbent as a goal for all of us. So Matt and Yolanda, please thank Secretary Fudge, who I know will be here in Baltimore on Wednesday. Our meeting with her, I know that we have a leader who understands. We hope that we can all build back better together. I'm sorry if I have missed thanking anybody. I invite you to join us at the listening session, and I will ask Alice Kennedy, our housing commissioner here in Baltimore, who is greatly committed to healthy housing. When we met as a transition team, I was honored to serve on the transition team for Mayor Scott on the housing issues. Alice made a compelling case to the transition team about healthy housing, and so I'm honored to introduce her, Alice Kennedy, a silent Cleveland Browns fan, I think, maybe, but maybe not.
Not anymore, that's true. Good morning, everyone. I just want to say this is a beautiful morning for all of us to be out here today, celebrating 30 years of the existence of the Office of Lead Hazard Control in Healthy Homes. And, you know, this work, everybody that has spoken before me has highlighted the amount of coordination and partnership that it takes to advance the work of lead hazard reduction, to advance the work of healthy homes, to advance the work of creating safe places for every generation of Baltimoreans to live within their house. Everybody from 1 week old to 79 or 89 years old all deserve a safe and healthy place to call home. And that is what we are here to celebrate, the work that has happened, and to look to the future to what we still need to do. I want to definitely take this time to thank the Department of Housing and Urban Development and Matt. Your team has been extremely supportive of the work in Baltimore over the years. I've gotten a chance to know you and Michelle and Yolanda and Jeanette and the entire group, and I just want to thank you all for your continued commitment to Baltimore. If there's one thing I can say, the team at HUD fully understands the need that exists in Baltimore for lead hazard reduction dollars. And while it is a competitive grant, and we apply and we put our best foot forward, when we are and if we are awarded, they are the first to show up to say, how else can we help you? How can we help you move this forward? And how can we be a partner at the table? And I just want to say that that partnership at the federal level is extremely important to the work that we do. I also want to take time to recognize the staff at the Department of Housing and Community Development. The Division of Home Ownership and Housing Preservation with the Lead Hazard Reduction Program has been doing amazing work across the city, coordinating the work with our contractors, participating in the state's lead commission, and continuing to advance the work that we do around lead hazard reduction and the intersection of energy efficiency and health and housing. So I want to take a time to recognize Acting Deputy Nicole Hart, Assistant Commissioner Jim Hicks, and the Director of the Lead Hazard Reduction Program, Shanika Fraser-Kyer. Also, their entire team, and before I was acting commissioner and now housing commissioner, I was the deputy of the home ownership and housing preservation. I have had a chance to work side by side with this dedicated team of city employees. And Mr. Mayor, I would say that we have a tremendous number of dedicated employees across the city, and this team really understands and gets the importance of the work that they do and has a kind and compassionate and loving approach to the work to help families as much as possible. And I want to highlight that here today. I also want to highlight the work of our other fellow city agency and the health department. Our team works in concert with the health department to address our lead hazard and elevated blood lead levels. And Camille Burke and her team are just totally invaluable to what we do and how we approach, and with the same level of kindness and caring and compassion, and how we can continue to help families as we move this forward. You know, Baltimore City, as it's been stated, is a city with old housing stock. We know that there are a minimum of 25,000 properties where the deed hasn't transferred in 25 years or more. We know that that means that there are families living in the home. A lot of those families were also a city of multi-generational families, and a lot of these families have grandchildren and visiting that either live with them or visiting children. And the work that we're doing and how we're looking at the future is ensuring that we can connect resources across all different programs. So it's not just the lead hazard reduction work, but it's our weatherization work, it's our housing upgrades to benefit seniors work, it's our office of rehabilitation work, and how we connect that to not just do the actual construction with our team members and our contractors, but also how we connect that with social services and wraparound services to achieve the greatest outcomes that we can for our families. We want to ensure not only do they have lead-safe homes to reduce the risk of lead poisoning, which we know impacts our children and has that negative impact with the one component, but we also want to ensure that we're also addressing asthma reduction and fall prevention and all of the pieces that create truly safe housing for all residents across the city. We're lucky right now in Baltimore that we are actively deploying over $13 million of lead hazard reduction grant money from the federal government, and also includes weatherization funding as well. So I want to say that we are here, we have funds, we are in the community, we are working with our community partners, and we are going to continue to deploy those funds. I also want to thank the state. Without the state's assistance and matching funds, you know, they are always there at the ready to help when we're doing our applications for the HUD grants. And the state funding also helps us unlock those federal dollars. So the team is actively deploying those funds, and we're looking to the future where we can create clean, healthy, sustainable, and resilient homes and create the healthiest and cleanest environment that we can for our residents. Thank you.
So sometimes if you say it into the universe and you will it, it happens. Delegate Rosenberg has joined us, and Sandy, I said some very nice things about you before you were here. Sorry. But I will say that our legislature in Maryland, we are grateful and understand the uniqueness of what we have and the boldness of setting forth the nation's most stringent and most comprehensive laws on lead, addressing lead in water, thinking about things like right to counsel for families who go to housing court. Sandy Rosenberg is always at the heart of every one of those discussions, and we would not be here today without his vision in the Maryland legislature, so I'm proud to welcome Delegate Samuel Rosenberg.
Thank you. I was thinking of saying that I've been working on this for 40 years, which may seem like an eternity or a long time, but then to be referred to as the universe, just an introduction, puts everything in perspective. What we're really talking about is individual families. Individual families whose lives, the children whose lives are poisoned for their eternity, for their time with us on this earth because of lead poisoning in the property that they rent. Lead poisoning which is, or poor conditions which are justification not to pay the rent. Ruth Ann making reference to the right to counsel in rent court. It's a struggle. We have great allies. Ruth Ann, clearly a national leader in this. The mayor, the city council president have all throughout their careers been leaders. There are also people from the philanthropic community, Bob Embry. I believe that's Josh Sharfstein that I'm looking at straight ahead. Yes, indeed. And each and every one of you here today, as a volunteer, paid, families, we all play a role in addressing this problem. There are new resources as part of the stimulus money from the federal government to deal with the issue, to also deal with the issue in schools, that our children can't drink from the water fountains in schools. We're working on that, and we will make a difference there as well. So, sorry I'm late, but I'm not late to the party because I've been working on this with Ruth Ann and many of you here today for the last 40 years. So thank you very much.
We're going to close only to say we are not done. I think that the horizon is brighter than it has ever been. It is our goal that Baltimore lead this work. I have staff here from all over the country today working on major projects in Milwaukee and New Jersey and Pennsylvania and California, where GHHI helped to move the state Medicaid program in California to now reimburse for asthma interventions up to $7,500 a home. We're investing in places like New York. But this is our home, and this is our opportunity. Every single one of us, I look out at Corliss, who I probably drive crazy, but has been instrumental in providing housing choice vouchers for families with lead poisoning, the only city in the nation that does that. We have so much vision and so much talent and so much opportunity. So it's onward together. Please join us at the listening session so we can learn what we need to do better and stronger and more. But thank every single one of you who cared enough to be here today to honor Mrs. Valentine and the many families in Baltimore who deserve a better future, and will get it with your help. We thank you. Thank you.